So today's class is typical ribs. How many ribs are there? 12. There are 12 pairs of ribs in human body. So out of them, this is the first one, okay? 1, 2, 3, 4, 5, 6, 7. These are called true ribs. Why? And what are the false ribs? 10 or 12? And what are these two? And what is typical rib? Typical? So typical ribs are having typical configurations, okay? So from 3 to 9, those are called typical ribs. What are the configurations, the features? CAT, these are curved, as you can see here, okay? These are angulated, like they abruptly make an angle with the, this is shaft, okay? This is the shaft, this is the posterior end, they make an abrupt angulation, okay? And they are twisted in such a way that in a horizontal plane, the anterior and the posterior end doesn't lie in the same horizontal plane, as you can see, okay? So these are the typical features. So from 3 to 9, these are the typical ribs, okay? What are those features? ठीक है, बैठो, ठीक है। नोट्स नहीं मिलेगा, सब कुछ बुक्स में है, उधर से देख लेना, मैं भी बुक से ही देख के आया हूँ, ठीक है। सो अभी मैं एक्सप्लेन कर देता हूँ, आई विल बी टेलिंग यू व्हाट टू राइट, ठीक है, बाद में। सो सपोज दिस इज ए टिपिकल रिब, सो दिस इज द एंटीरियर एंड, ठीक है, दिस पार्ट up to like this part, okay? These are the costal cartilages, okay? So you can say up to this part. This is the anterior end, posterior end, this is the shaft, okay? These are majorly the three parts. Now you will have to explain कि कौन से part में what are the things that will be there. So in the anterior part, you cannot see this, the large branches, right? दिख रहा है क्या? उधर से दिख रहा है, मुझे तो इधर से भी नहीं दिख रहा। So yeah, this part, this is a small cup-shaped depression, a concave depression, ठीक है? In the anterior end, इधर क्या अटैच होगा? Costal cartilage। तो पर क्या है ये क्या? तो आती भी नहीं है प्रैक्टिकल क्लास में। You are always roaming here and there, ठीक है? So costal cartilage will be attaching there, ठीक है? So in the posterior part, side determination मैं बाद में बोलता हूँ, ठीक है? In the posterior part, this is head, this is neck, this is a tubercle on the posterior end. These three things will be there on the posterior end of a typical rib, ठीक है? Head, neck and tubercle, these three things. What is neck? Constriction और कुछ? Anything else? Long? In a bone, not from general anatomy, but in a bone, if the examiner asks you what is the neck, what is neck of a bone, then you will have to say the thing that is joining the head with the shaft. Head with the shaft is the neck part. Constricted हो भी सकते हैं, नहीं भी हो सकते हैं, doesn't matter, okay? This is neck. So, how many thoracic vertebrae are there? 12 thoracic vertebrae are there. So suppose these are the thoracic vertebrae, okay? This is a typical rib. This will be attaching like this. Agar you don't have the bone with you, how will you see? These are really small structures. This one you cannot see from the far back. You cannot see it. I don't know. See, दिखाऊंगा. Okay, let me explain first. So this is the head. Okay, in the head, if you have good eyesight, you will be seeing there is two facets. In the upper end, one. In the lower end, one. And in between them, there is a bony ridge. That is a crest of a bone between those facets. Okay. So this upper facet will be joining with the corresponding thoracic vertebra. Suppose this is the seventh thoracic rib, typical rib. Okay. Suppose this is the seventh thoracic vertebra. Okay. This will be, I don't know how will you see it. Okay. This lower facet. This is lower facet and this is the larger facet out of these two. This will be joining with the corresponding vertebra like this. Okay. Suppose this is seventh and this is seventh. It will be joining, the lower facet will be joining with the seventh vertebra here. Okay. And the upper one, the upper facet, that will be joining with the vertebra above it. Matlab with the sixth vertebra. Okay. Because if you can see, there is also a notch, there is also a notch. If you can see, these notch are to accommodate these facets only. Okay. That is an example, na? It is not the sixth. I have to count them. This lower one, again I am telling, this lower one, this is the lower larger facet. Out of these two, the lower one is the larger. Okay, it will be attaching with the corresponding vertebra. Agar ye 7 number hai, it will be attaching with the 7th. Okay, if this is the 7th, okay, number milega. And if this is the 6th, this upper smaller facet will be joining with the 6th one. Okay, wait. Then this is the neck. What is neck? What is normal pulse rate? So, this is the neck. If this is like this, the neck is having upper border, lower border. This is anterior, or what will you say, anterior, posterior? What is this surface? If I say there are two surfaces, this is the anterior surface, this is the posterior surface. Okay? This much for the neck part. Okay? क्या नोट्स लिखना है मैं बाद में बताता हूँ. ठीक है, पहले ये देख ले. Then comes the tubercle. This one, this big one. You will be seeing this clearly in this original book. ठीक है, this is pura is the tubercle. This whole thing. Okay. It is also having two parts. This one and this one. Okay. If I am holding this one. Okay. If I am holding it like this in anatomical position, this will be medial or lateral. If it is like this one. So this medial part is the articulating part. It does articulate with something. And the lateral one, this is the non-articulating part. It doesn't articulate with any bone. It does accommodate some ligaments like transverse ligaments and all. Okay? So where does it accommodate? The medial articulating part of the what? Tubercle. These are called the transverse process of vertebra, thoracic vertebra. Okay. So if it is attaching like this articulating part will accommodate with the transverse process of the vertebra. Yes, say either like this. Okay. In the transverse process, it will be attaching. Okay. समझी श्रीषा? क्या बोला मैंने? Transverse process of vertebra. ठीक है. So this is about the tubercle of posterior end. Then comes the shaft part. In the shaft, you can see everything okay. In the shaft part, as you can see, two borders are there. Upper one, lower one. two surfaces are there, inner and outer. Okay, so the outer surface, is it concave or convex? Concave, convex. Okay, the outer part is convex laterally. The inner surface is concave medially. Okay, there are two borders. If you hold it, you will be feeling that the lower border is more sharp than the upper border. Okay, the upper border is somewhat thick and having a broad surface. So like the femur, this is also having the outer lip and inner lip. Okay, this is the outer lip of the upper border, this is the inner lip of the upper border. Okay, you need to remember that, because there are some muscles that is there are some muscles that are attaching on this outer lip and inner lip. Okay, in the dissection I hope you have seen the external intercostal muscle. The external intercostal muscle is attaching on the outer lip of the upper border of the shaft of a typical rib. Got my point? Outer lip and inner lip. Which muscle is attached in the outer lip? Abhi bola. I see you are still in Kamli era. Better. So the outer lip. Okay? Which muscle is attaching here? And in the inner lip, okay. So in the inner surface, matlab the medial surface, you will be seeing this is a groove-like structure here. Can you see a groove-like structure? This one? Yeah. Pass it to everyone. Feel the groove. This is called intercostal groove. In this intercostal groove, the intercostal vein, intercostal artery and intercostal nerve will be there. Okay? In the intercostal groove. Okay? So, if this is the intercostal groove, सबसे ऊपर there will be intercostal vein, then artery, then nerve. VAN, vein structures will be there. पूरा ऐसे करके जाएगा ऐसा, ठीक है? लंबर प्लेक्सस से या वर्टिब्रल प्लेक्सस से निकल के ऐसा करके जाएगा, ठीक है? The VAN structures will be there in the intercostal groove. Now, in the lower border, this is a sharp border, sharp lower border. This is giving origin to Bibashon, what happened? दारिया देखा? কি থাকে ওখানে? কি এটা? ঠিক আছে। So, the lower border is giving origin to the external intercostal. Okay, so I am telling you, if this is the rib, suppose this is the lower sharp border of the shaft, okay, of a typical vertebra. It is originating from here and getting inserted in the lower rib in the outer lip. समझी क्या? नहीं समझे? Outer lip. The external intercostal muscle is originating from here and inserting in its lower rib, in the outer lip of the shaft of the typical rib. समझी? बता. Very good. अभी खड़ा होके बता. And where does it insert? Intercostal groove. Where does it insert? Afros. Lower? Lower lip. Lower border. Don't get confused, huh? This is pretty easy thing. Again, if this is the rib, suppose this is the rib. This is of left side, by the way. This is the left-sided rib. Origin, okay? Starting from here. This is the. इसको आगे पकड़. Let's see. Suppose this is the rib, okay? This is the lower border. The external intercostal is originating from the lower sharp border, ठीक है? And inserting in the outer lip, okay? इधर में भी outer lip है, तो इसमें ऊपर वाले का external intercostal आगे insert होगा. Got it? Got it? बता भाई.
Inner, outer, upper, inner. इससे confuse हो गया. एक बार फिर से बोलो.
Tongue twister है क्या ये? सोच के बता.
So lower border से आके upper, inner lip.
Not inner lip. Outer lip.
Outer.
Got it? अब इसको ठीक है. बैठो. There are two more muscles you need to know. There is another one. This is the intercostal. What is this? From the floor of the groove. From the floor of the intercostal groove, internal intercostal muscle is originating. ठीक है? From the floor. And it goes below and insert on the inner lip of the below rib. समझी क्या? From the floor of the intercostal groove
and gets attached to the inner lip of
the lower rib. समझी? But and from the upper part of the intercostal groove, another muscle is there. Intercostalis intimus. Innermost intercostal जिसको बोलते हैं. So the innermost intercostal muscle is originating from the upper part of intercostal groove, and it also goes to insert in the inner lip of the lower rib. समझे? बोल. Just now you said you got the point. And explain to the class. अभी तक जो पढ़ा है. Face the class. Face.
So this is a typical rib of our eyes. About its features, these are borders and surface. The anterior surface and the posterior surface. So the borders.
Yeah, help your friend.
This is the head of the rib. This is called the tubercle of the rib.
बोलो.
This is the head of the rib, and this is called the tubercle of the rib. Head of the rib joined to the vertebrae, and the tubercle of the rib joined to the transverse process of the vertebrae.
बाकी part, anterior part, shaft, muscles.
This is the shaft.
Shaft. What about the shaft? What about the shaft?
The shaft anterior surface is somewhere in the posterior surface.
Anterior, posterior, or medial, lateral? Do you agree with him? Tell me.
So in the head there
To
are
the class.
two facets are present, which goes and attaches to the vertebrae. Right? So explain that part. For example, there is two vertebra and the lower facet goes and attaches to the lower part or lower accommodating surfaces present in the vertebra. Yes, sir.
বল তারপর
And the upper facet accommodates in the upper accommodating surface present in the vertebra. So that was for the head. In the head, just below the head, there are two tubercles, medial and lateral. Medial tubercle articulates with the transverse structure of transverse
process.
transverse process present in the vertebra. So there is the articulating part. However, the lateral tubercle doesn't articulate. It gives space for some ligaments present. In the shaft, there is a groove is present, intercostal groove, from the floor of which internal intercostal muscles originate, and it gets inserted to the neck strip in inner lips. For the external intercostal muscles, it gets originated from the upper border of the rib and gets inserted to the neck strip, outer lips. And there is another muscle which gets originated from the upper floor of the groove, intercostal groove, and insertion I told you.
Inner lip only.
Inner lip.
বুঝছস?
So that's what.
Yes. Or there are two angles. If this is the posterior end, it is making an abrupt angle with the shaft, as you can see. ऐसे आके it is basically 5 centimeter. Not that much accurate, but it is basically 5 centimeter from the tubercle, where the shaft is making an abrupt angle with the posterior end. So this is the angle of the rib, and this is the most common place of rib fracture. If you have a rib fracture, the most common place will be this angle. Okay, the posterior angle of the rib. So और कुछ है नहीं. So for the side determination, suppose if you are given this bone, you will be telling the anterior end with the small concave part will be facing anteriorly. The lower sharp border will be facing inferiorly, and the posterior end having the head, neck, and the tubercle will be facing posteriorly. With these three things you will get to know if this is of left side or right side. Okay, and again, if this is left sided, hold it with your left hand. If this is right sided, hold it with your right hand. Don't miss out on that. That will determine if you will pass or fail. Okay, at least you need to know all the basic things, the basic structures. If not the muscle attachment, at least you need to know what are the parts of the bone, if it is left sided and right sided, and the points in favor of this bone being left or right sided. You need to mug up these things. Okay, with this you will be getting 50%. That will get you the passing marks at least. So yeah, you need to know this much. अगर इतने तक आता है, then you will be asked further where is this muscle attached and that and all. ठीक है?